through the CDC, and the pharmacy will let you know that. They'll give you information. And when you sign up, it's just an app on your phone. They will text you. They'll check in with you, see how you're feeling, make sure you and ask if you've got any side effects, and you can report those that way. And it'll also remind you when it's time to do your second dose. So with the vaccines, the researchers are going to continue to monitor and study safety. Even after you get a shot, you still have to wear your mask and social distance for now, because it takes a couple of weeks to build up your immunity. We don't know yet. This is all so new. We don't know yet whether or not after you get vaccinated, could you still possibly spread the virus to other people? We don't know the answer to that yet. And there's only been about 9 million people in our country out of 330 vaccinated so far. And the last is also to set an example. When you're out in public, people don't know whether or not you've had the vaccine or not. And if you are walking around without a mask, that really doesn't set a good example. So for right now, while we're in the middle of the pandemic, we will continue to wear masks and social distance, just like always. I've got a list of resources. I'll send those to Ashlyn, and we can make sure that those get posted. And I know that's just a more or less a brain dump of all of the information that I could find about it for this week. We've got some questions over here. Thanks, Ashlyn. Thanks for putting those out.
I was just about to say, Sandra, I have posted you guys into the chat different links that Sandra sent me earlier this week where you can go and get more information. And I would suggest that you do that. And then, Sandra, do you want me to help by just reading the questions? Would that be helpful?
I think there are just two, it looks like, about there. One, it says the bacteria cannot live without a host. If it dies without a host, why are we sanitizing? Number one is it's not a bacteria, it's a virus. Those are very different things. The bacteria can live on surfaces sometimes for a long time. Viruses vary. This one in particular can live. It is possible. Sanitizing is one of the ways that we stop transmission. If someone gets it on their hands, touches their face, rubs their eyes, then it could be transmitted that way. The vast majority, vast majority of infections are spread through breathing on each other. That's how we're spreading it. We're breathing on each other. And so that's why the mask is so important, because we don't want to breathe those particles on other people. About half of the people that are infected don't have any symptoms. So their breath just spreads it to other folks. So that's why we're sanitizing, is because we cough, it goes on the table. If we don't sanitize, someone could touch that table immediately and then transfer it to themselves. Should we take a pain reliever before we get our vaccine? Yes, you can do that. And will we still have to quarantine? Yes, we will still have to quarantine at this time. That may change as time goes on, but it doesn't change anything as far as that.
Hey, Sandra, I'm going to go back up to the top. This is Tanya. There was a question. There's some questions about, is it mandatory? No, it is not mandatory for anyone to take the vaccine, unless maybe some businesses, maybe, hospitals, some places may as a business. That's a decision that your business, but as a state, as a regulatory agency, we are not mandating that. So it is a choice. There's some questions about where will that happen? Will they be coming to us? Let me just share with you that, as we continue to broaden out populations, the access points will get bigger and probably change. Certainly pharmacies may be one access point, but it doesn't rule out, health departments or churches or other places where community people might gather. So those are details that will be worked out as they begin planning this phase 1B, which includes, a broader part of the population. So we certainly can recommend these things, but just know that we're working in coordination with the Department of Health and others around the vaccine implementation. And so we certainly can make that a recommendation, but we will, as we get details about where the distribution points are going to be, we will be covering that in this call. We will keep you guys updated every 2 weeks about, where we are and what might happen. So, so Casey Wiley had asked about how do we get it? We've talked a little bit about that. Not all the details are worked out, Casey, but does it apply to office staff? It applies to any of your staff that are working in your facility. My numbers are big because I knew there were management staff and admin staff. So anybody that you want to send that works in early childhood childcare, the details of how they will demonstrate that. I know some places do not have badges, but if they have a picture ID that has that information, that would be one way. But we will work and determine. I think at this point, if people just come in and say, I work in this facility, they're probably going to give you a vaccine when we get into this next population, but we will work on how to do that. Maybe we'll have people take their license number. I've had some people reach out to me about that. The details have not been worked out, but this is really not about excluding people. It's about including people and making sure that everybody gets vaccinated that wants to. So we will keep you guys apprised, and I'm sure Dr. Tumlinson and others will come back and other people involved in the vaccine as we get closer to where we are in the phasing. But I have sent some numbers, and I sent really big numbers to them to include office staff.
In 1A that we're in right now on the health department website, it has a list of pharmacies that are managing that group. So my assumption is that when it gets to 1B, we'll have the same kind of thing. You'll have a long list of your options, along with the other information that Dr. Tumlinson will share with you.
All right, thank you. I see a few more things. And so I know there's some questions about money, essential workers. We'll get to those in just a moment. Casey, thank you for putting the note about Fayetteville. It looks like their pharmacy, they were able to get on a list to be notified as their pharmacy, or one particular pharmacy, is going to be doing vaccinations. So, you certainly can look on, and thank you, Sandra, for mentioning the health department's website. You certainly can look at what's available, and you certainly can reach out to pharmacies in your community that may be an administration point and perhaps get on a list. I'm going to shift us because, again, we do have a pretty full agenda. Sandra, thank you so much for sharing with us. We appreciate you so much, as always. I've asked Patricia Johnson, who works on my team. There have been questions as we get into this next round of funding. And so let me just remind folks, we do not have any letter of award, and I cannot do anything with regard to new funding until I get that. I've given you what we plan to do, which is very similar to what we did last time. We're going to try to do it better and improved, but we will be paying. I saw a question about essential workers. Essential workers, we are going to extend those through the end of the month. We will be processing a payment for the first 2 weeks at the end of this week, so the 1st through the 15th, and then we will process a payment through claim at the end of the month. But the process for this month for billing is through a claim. So you will not see an authorization and you will not bill for essential workers. The supplemental payments, once we get funding, we don't have any. So the ones we're paying for right now are just your regular low-income child care assistance that are on normal CCDF. We are processing those payments every 2 weeks through claim, just like we're going to be processing these essential worker payments for January. We will continue doing supplemental for just the low income until we get the new funding, and then we will start processing payments for essential workers. So right now, your supplemental funding is only for regular. Once we get funding, we will be able to extend that to essential workers as well. For those of you who may have essential workers that are eligible for low income, I know there was a question about whether or not they should go ahead. Brandy and team, if you guys could post a response back there, I certainly am not opposed to a family that's eligible for regular to go ahead and submit their application. We may let theirs run through January to utilize all of the resource, but if they're a normal, regular, low-income child care assisted family, then we'll get them moved over. But Brandy, if you want to post a response in for that. Okay, I'm trying to go back through. Patricia, I'm going to hand it over to you. Patricia is going to be doing this, I think, from her phone, but she's just going to walk. If you are not currently set up to take funding from the state, it is very critical. I'm not talking about essential workers. I'm just talking about the ability to pay you. It is really important. Patricia's going to walk you through that process. So, Patricia.
Good afternoon. Can everyone hear me?
We can.
Can everyone hear me? Can you hear me? You can? Okay. So I'm going to talk a little bit about the participant agreement as it relates to getting you all paid. Also, if you're, and I think a lot of people have already been set up and familiar with our participant agreement. So this relates to your facilities that you may want to add on, or any new providers that are on the call that currently do not bill the state for services. You have to be a level 2 facility in order to be able to participate in our program. You will need to contact Dawn Jeffrey or her team for information on Better Beginnings. For that additional facility that you may want to add on, that facility has to be level 2 as well. After you have been certified at Better Beginning Level 2, you can contact my staff at 501-682-8947. Myself or my staff will be able to assign you a password to access the online training to complete. Once you complete that online training, you'll be given an exam to complete as well. After you complete the exam, you'll be able to download the required documentation. You need to complete all the documentation in its entirety and submit back to our office. Processing time usually takes 3 to 5 days, depends on if there's any discrepancy. So make sure that the information that you complete on the paperwork is the same information you submitted to licensing, because all of that information has to match. Once we get you approved, we'll be sending you approval email and also the information on how to bill the state for services. And of course, me and my staff will be available to train you on the child care billing as well. Now, for those that are already billing the state for services, I want to touch a bit on untimely billing. We do run reports on this information, and I want to refer you all back to the participant agreement on page 8, letter E, number 5. So we want to talk a little bit about untimely billing. When the authorization is keyed, it's keyed out for 6 months. But for 6 months, you have 60 days from the date of service to get that billing done. Now, I do not recommend you wait 2 months to bill the state for services, meaning some of you may have more than 10 children, and 10 children for more than 30 days could kind of set you back a little bit, so you kind of fall behind. And once the authorization starts to deobligate after 60 days, we are not going to open that authorization back up. So that's money you have lost. I highly recommend that you bill weekly. And if you bill weekly, you'll be paid the next following week, unless there's a delay in our payment system or some type of holiday or something like that, that'd be posted on our child care billing website. Most of our information that we update when it's related to the participant agreement or related to the billing is going to be posted. If there's a delay or anything, it's going to be posted on our child care billing website. Even this information now related to Essential, when there's an updated announcement, we're going to post it on our website as well. So with those of you that are billing, we also want you to be mindful with the funding that's coming from Essential. Some of you all will reach over $100,000. So you want to be mindful that in accordance with the guidelines for financial and compliance audit, that you will be subject to submit an audit for that calendar year. So you want to make sure that you be mindful when those requests come from our Office of Finance or our QA or compliance program requesting your audits. You have to submit to that in order to also be approved to participate in our program. And that's all I have. If you all have any questions.
Seeing questions in the chat box, but let me just, I'm going to run back through those. For those of you who have questions about the claims in January, we are paying by claim. You do not have to do anything. It's based on the children that you had enrolled. And so we will process, and my staff are fast. They've already paid you, or you may have already received a deposit for the first 2 weeks of January. They had that claim ready last week and have apparently already dropped that in. So if you can check your bank accounts wherever you receive the funding for regular CCDF, you will be able to see if that deposit has been made. And I see several people have received that. If you haven't, please reach out to us. It's probably on its way. You know, bank routing is different for all different banks in Arkansas. So some banks take longer than others, but the payment has been processed. And I have checked with staff, it's processed for all. Let's see. Supplemental payments, Brandy, if you can post something in. I don't know if we're current on supplemental. I know that staff were through December, but I don't think we're not through the first half of January, so we wouldn't owe any payments. Did we get all caught up through December? If somebody can post that. Okay, so can you put the date of what's being processed? Is it all of December or just 2 weeks in December, team? It looks like we're processing payments for that question all of December. So we're working on payments for all of December right now for your supplemental, for your regular low-income childcare and regular CCDF kiddos. I've had staff just ask me to remind you all, please make sure your email addresses that we have on record are up to date, and please check that and make sure. It will be very difficult for us to communicate with you if we do not have a current email address. So please make sure that you check the email that is on file and check with your licensing staff if you're not sure, and make sure that we have the most current and up-to-date email address. I've got a couple of things and then I'll go back to questions. We have about 20 minutes left. I have a colleague that is going to be sending out a national survey. And it really just, this is a way for you all to be involved in a process of input. The survey will come from Geraldine Slicker. It's Gerilyn. I'm going to put her name in the chat box. Geraldine is a student, a graduate student who is working with some folks at the University of Delaware. And this is a great opportunity for us to work with someone essentially to get free data analysis and research as they're working through their doctoral process. But I put her name in the chat box. It is a brief survey. The title will be Arkansas Child Care Provider Survey. It will come from Geraldine. It is a partnership with us, but it is really questions about decisions regarding enrollment, but it will really help us if you can fill that out. I know a couple of you volunteered and participated in a pilot with Geraldine, but for any of you, we've sent the list to her. So if you get that, and if you have an opportunity, we know that everybody won't be able to, but it is a great way for you to have input into informing us about what's working and what isn't working. So I hope that you'll take that seriously. Geraldine did remind me the survey will be out. It'll be sent tomorrow on 1/13, and it will be open for 6 weeks through 2/26. And for individuals who are with a multiple program situation like Head Start and school districts, she did say that multiple entities could respond to the survey. So all of your licensed sites can respond unless you want to just submit one. So I just wanted to make sure that I put a plug in for that. Again, it's a wonderful way for you all to have input into the process. I'm going to spend a few minutes going back through these questions. We will be working on, again, we are currently waiting on the actual letter of award from the federal government. We don't have any authority until we have that. And so we can't do anything, even though we know there's going to be money, we are waiting on that. Once we get that, then we will be able to start processing the existing essential worker families. Those will be extended through, the plan is to extend those through June 30th. We have a plan through January 31st. We'll extend their authorizations and you'll do normal billing if we get the letter of award starting on February 1st through the end of June. Then we will start processing new applications. There is a new application and there will be a new email address. Please, we will not be sending that out until we have the official letter of award. If you are not an approved provider, if you do not have everything set up, please do not inform a parent that you do. That does not look good. It actually looks like you are misrepresenting facts, and we take that very seriously. And that might jeopardize your opportunity to serve as a voucher provider. So please, that's why Patricia's on today. We don't even have the money. You have time to start working on that process, but you have to be set up through the Department of Finance as a state vendor. You have to get the CCDF participant agreement in place, your Better Beginnings in place. Please know that if those things aren't in place, then we'll have a hard time working with you. But please do not misinform families that you are in fact an approved vendor. That is one of the requirements from the feds, and it's a requirement from the state that you have to be approved to do that. And that means you have to be set up. It will cause a great deal of frustration for families if you're not. And we will let them know that. We will deny applications this time if it's not an approved state vendor. For all of you programs that have already suffered through the processes, thank you. It doesn't feel fair for you that have already gone through to let other people shortcut. So please know that. Talk to your colleagues that have done it. I'm sure they're more than willing to give you advisement, but you must work through the process like your colleagues have done. We have many, many providers that are set up, many, and we're in a very different place than we were last March when many programs closed. We have more programs licensed and open right now than we have had. So just know that if we see an area that doesn't have an approved vendor, we'll work with that community, but we are not making exceptions to that. So please start working on getting yourself through those initial processes. And if you're already a level 2 or 3 provider and you're not taking vouchers, then you are already halfway through the game. So you just need to get set up as a state vendor. There will be more funding and law for, it's really going to be called maintenance, but we do have proposed part of the new funding for what we're calling a maintenance payment. And we are planning, once we get the letter of award and we put that out, we'll put that out on our website. We'll be announcing it on hopefully our next call, and we'll be letting you know how to do it. But we'll be paying that quarterly this time. So you won't have to do anything. We'll just process a quarterly claim. If you are going to close your facility, if you're going to temporarily close, please make sure you're letting your licensing staff know that. We want to make sure that we're paying people that are open, and we sure don't want the money to be processing and going where there isn't somebody there to receive it, whether it's by mail, which there are very few that will go by mail. Most of them are going to be a direct deposit, but I do know we had some returned mail last time. So please know that's very frustrating for our State Department of Finance as well as for us. So I see a few, and I know we've had this question before. I will make a proposal, Cassidy Harrison, that my team will do some training. We'll schedule a Zoom call to talk about how you can utilize the tool in child care, kid care to review your claims and the money that you've been paid. So Patricia, if you'll make a note of that, we will work with you guys before our next call or announce on our next call some training. I appreciate that. We do know we've had lots of questions about the amounts, but we can definitely work with you guys on how to read and review your remittances in that system. And so I appreciate you for putting that question in. Anna Weaver, staff will work with you if you will. I just want to make sure we have your information. If you'll reach out to Brandy Ishman on my team, and I think Brandy's already posted her information in the chat box, but she'll work with you on a closure for COVID in January. So yes, we will work with you on that. So yes, if you have any families that are on vouchers, whether they're essential or regular, if they were quarantined due to COVID, please get with Brandy. I think she's put information in. You will still get a payment, but she's given you, I think, the information now that I'm looking. So the billing for extended essential vouchers, you do not have to bill. We will be paying through claim. You will not need to do anything. Brandy's answered that. So if you just check your account, you've probably already been paid for the first part of January. And at the end of January, you will receive another. And it's based on the children that you had enrolled on vouchers in December. For those of you who are asking about some specific things, staff, can you check that? I've got one from Lynn who is concerned about extra payments. I'm assuming supplemental. And then question about background check payments. If you have paid for your account, you are good through the period annually. So there's nobody that should be due for anything unless you just haven't signed up yet. So, and we are paying for all of those currently. We are paying for that. We are working with them, and we had a call just this week, and our folks are going back to them to work on a process as we go forward into the next period that you all will be able to pay as you go, and we will keep you guys updated. But for any of you that are going, that have paid already, if you haven't been reimbursed, make sure that you send us that information so that we can reimburse you. We need your invoice, and you are good for an annual period from the date of which you enrolled and got signed up for that portal. So yes, Paige has responded. So thank you, Paige. And the INS annual fee, I'm sure somebody's probably already posted that in, but it is an email, and I believe it's ins@dhs.arkansas.gov. But if one of you can post that in the chat box, we have been receiving and reimbursing programs for that. So Melissa, yes, if you have an essential worker, yes, if she is actually a low income, anybody can submit an application to our division. They just have to qualify for regular, and they would have to qualify for essential based on their job. But please, if you have any families that you're serving, don't hesitate to encourage them to fill out either our normal low income childcare or for essential. We will be sending out instructions for the new funding once we have that. And yes, Tara, we will be accepting additional essential worker vouchers. We know through June 30th at this point, that is the longest period that I can tell you, again, without seeing an official letter of award. Yes, if you have families that were essential but is no longer working, because that kind of indicates that maybe they don't need it anymore. So we definitely would want to know that. I don't know anything about minimum licensing regs being changed. We have nothing in promulgation, Miss Rita. So
Can I interrupt? I first read that question that way too, but then I remembered we did have the regulations updated that went into effect January 1st. And you guys, all that did is cleaned up the reg book where it originally had like dates things were due. And so now it just took out that language and cleaned up the licensing book. There were no major changes to the minimum licensing requirements. But those will be posted soon on the website. I think that's what they're talking about, Tanya.
So I'm seeing a lot of questions about the INS annual fee, folks that maybe have sent in something. Team that's reviewing that email, if somebody can post in, that we need to make sure we're monitoring that. And I really don't know right off the top of my head, gang, but we definitely do have an email address that we're having those submitted to. And I will be working with the team to find out. Brandy's put that in. It's INA receipts at dhs.arkansas.gov. So if you have not been reimbursed, please check. If we look, we can verify. It may have posted to another payment that you received. And if it got lost in a voucher payment, which it could have, that could be confusing, but we can definitely verify for anybody that's concerned that you've already submitted, but we can double check. So please reach out to, hey team, I don't know who you guys want them to reach out to on the INA receipts, but if you'll type that into the chat box so that they can reach out and determine if we have gotten their invoice and have paid them. Right now, you are not submitting any new essential worker applications. Please let me repeat this. We do not have official money yet from the feds. We're not taking applications yet. We will notify, we will make an announcement, we will put it out, we will discuss it on this call, but we right now will be working, as soon as we get the letter of award, we'll be working on the essential families that we have now, getting those extended, and then taking new applications. So just a reminder, we are not currently taking any new ones, but we will be making an announcement when we're ready and where they will submit and the new application process. So I think have I missed anything? Anybody see anything that I've missed? I did not look. So we had 215 participants. So I just want to say thank you. We moved this time to try to accommodate, and that's certainly a few more folks than we've had, in December, which again was a slower month maybe, or a different kind of month. But I'm really glad that more folks were able to get on. Please encourage your colleagues. I do see if you have a parent, no, that's the one that I already answered. So yes, if you have anybody that's taking child care vouchers or subsidy and you think they're not working, please let my staff know. If it's regular, that is a problem. If it's supplemental, we will work with you. I mean, we really we could just end it now instead of extending it out through the end of January. But generally speaking, those are for families that are working, and that's the difference in this program and others. Yes, for those of you that are level 1, your time frame for getting to level 2, remember this is level 1 folks that were level 1 prior to the new requirement of level 2. So that went into effect, team remind me, 2019 or 2020. I think it was January of 2020, programs had to come in at level 2. So we did let some exceptions for essential workers this past year, but we will no longer be doing that unless there is just no other provider in that community at all. And I mean, we have the data to support that and justify it, because we're going to have to do that kind of justification. I don't expect any of the pandemic procedures to change right now. As we get further into the vaccine, there may be some changes, but at this point, I've not heard any recommendations. And let me just let you guys know that in the new act for funding, the new relief funding, it specifically states that you have to be meeting either Centers for Disease Control requirements for pandemic or your state Department of Health. We are using our state Department of Health guidelines, but if you are not using those, you cannot get the money straight from the federal law. And I have a copy of it in front of me. They were very specific about that. They are also recommending, this is not a mandate, that is a mandate. They are also recommending that the funding that you receive, that you try to pay salaries of your employees with that. I suspect most people do, because that's the biggest item that most of you are probably paying for. But that is a recommendation, that the funding from this new relief package helps offset the salaries of employees working in early care and education. So I just want to make sure everybody understands that there is a mandate to follow CDC or Department of Health. That is our pandemic requirement. So if you're following our pandemic requirements, you will be eligible. But if you're not, you could risk being able to take those programs. Kristen, I'm not sure, the notification of processing in some way. Are you talking about the claim process? I just want to be clear. We will be putting out additional information about the funding once we get an official. And I apologize, we just don't have it yet. The federal government has not released those to the state, but once we have it. Okay, thank you, Kristen. So deep cleaning. You will get probably just the remittance that it's been paid. We will work with you. We can double check that. For those of you that are not sure about that, we can certainly check, but I think this training how to review the billing inside the kid care system may be helpful. So we'll get that, we'll work on getting that scheduled for at least an hour and try to do it during lunch hour if that works better for you guys before our next call. So I'll have team work on that, maybe next Tuesday, if that would work. And there is, yes, thanks, Brandy, for posting that in. There is no income cap for essential workers. It is about the type they do. Gang, I've got to jump off. So I'm going to take us off this call. Appreciate you all again so much. Happy New Year. It's exciting that we're going to get additional funding. I wish I knew more about the amount, but we will have that and we'll start announcing that hopefully on our next call.